Hi everyone, I'm the gynecologist who lives in Thailand, and today I'm going to talk about one of the most common questions or the problems that leads women into my office every single day, which is the menstrual irregularities. Okay, so every woman has periods, right? So normally the interval of the period interval, sorry, the period interval of normal women is 21 to 35 days. So this one is we call the acceptable one. But for normal women, a very normal one should be like 28 to 32 days. But okay, so this is the normal one and this is the acceptable one. So if your period still in 21 to 35 days, this still fine. But actually, not totally fine. You know what I mean, right? But when the problems comes, it's like your period is absent for more than like 60 days plus 45 days, 60 days, or something like that. So your period does not comes on time. And so but most of the time, please don't forget, if you're sexually active, you may get pregnant. But if you don't get pregnant, let's see what can be the cause of your period irregularity. So there's three things. First one is so most of the times is the not three things, but most of the times it came from the hormonal imbalance, which is the three the three common hormones. First is the male hormone. Number two is the thyroid hormone. And number three, we call this the prolactin hormone. Okay, so what are these? So the most common one is male hormone. So in some women, you have too much male hormone in your body. So there's some kind of the misunderstanding that in women there's no male hormone, which is not true because every single woman has male hormone, but in the low level. So let's say 10 times lower than your male counterparts. But if you have too much male hormone, what happens? So the too much male hormones most of the time come from fat. So the chubby woman may have the abnormal period come from your too much male hormone because your fat will produce the androgen. The androgen is what we call the male hormone, and this androgen will disrupt your ovulation cycle. Okay, so I'll try to explain. Let's say, so this is your external genitalia, this is your vagina, this is your womb, and inside you have the the cavity called endometrium, and extended from the womb there's two tubes. Okay, these tubes, this is the vagina, and extend this. These are the ovary. Okay, so if we take a look inside the ovary, there's a small drop. We call this a follicle. Okay, and this follicle will get bigger and bigger. So inside the follicles, there's contain an eggs. Okay, and if the follicles is big enough, the eggs will be mature, and then is you ovulate. So normally these small follicles and the mature eggs to the ovulation takes around 12 to 14 days in normal female. And after the ovulation for like 2 weeks or another 14 days, you will have your period. But what the male hormone, too much male hormone do is send the signals to this schedule. Okay, so like the follicles, please, if you have too much male hormone, it will say, okay, the follicles, please stop going big. The eggs stop going mature. So the ovulation has to be prolonged. And so if the follicles not get bigger, the eggs not mature. So if you do the ultrasound, you will see so many tiny follicles in one ovary, and this is what we call the polycystic ovarian syndrome. Poly is mean much, many, cyst, the small one in like this, ovarian from ovary, and syndrome. So it means you have too much cyst in your ovary. So the way to treat these, very easy. Please lose your weight. Okay, so if you lose weight, everything will be fixed. Okay, and let's come back. Okay, so that's number one, the male hormone. Number two, the thyroid hormone. So if your thyroid is abnormal, you have too much thyroid or too few thyroid hormone, it may cause your period irregularities too. So this one is easy. You just take medicine and fix it. Okay. And the third one is the prolactin. The prolactin come from a part of your brain, which we call the anterior pituitary gland. Okay. So these will be released when you're breastfeeding. Okay. But if your prolactin level is too high, it will become the hormonal imbalance, and your period can go wrong too. So that's why if you treat the prolactin to the normal level, your period will become normal again. So just to conclude, if you walk into the women's department with the hormonal irregularities, what the doctor will ask and prescribe and make the diagnosis. Three things. First, they will do the ultrasound to check the PCOS, polycystic ovarian syndrome. Number two, they will check your thyroid hormone, we call TSH, the thyroid stimulating hormone. And the number three, we check for the hormone, the PRL, which is abbreviation form of prolactin. So I hope you enjoyed this clip, and please like and subscribe so you won't miss my next video. Thank you.